How do I rehabilitate a traumatized dog? Dogs, known for their loyalty and resilience, can sometimes experience trauma that leaves lasting emotional and behavioral scars. Traumatized dogs may exhibit a range of distressing behaviors such as fear, aggression, withdrawal, or excessive anxiety. Rehabilitating a traumatized dog requires patience, understanding, and a thoughtful approach. In this video, we will explore the steps and strategies involved in rehabilitating a traumatized dog, focusing on the physical, emotional, and behavioral aspects of their recovery. Recognizing trauma in dogs. Before embarking on the journey of rehabilitation, it's crucial to recognize the signs of trauma in dogs. Trauma can result from various experiences, including abuse, neglect, accidents, or exposure to distressing events. Common signs of trauma in dogs include fearfulness, excessive fear or anxiety, especially in response to specific stimuli or situations. Aggression, aggressive behaviors such as growling, snapping, or biting, often as a defense mechanism. Withdrawal, social withdrawal, avoiding interaction with people or other animals. Hyperarousal, being constantly on edge, easily startled, or exhibiting nervous behaviors. Excessive vocalization, barking or whining excessively, especially when anxious or distressed. Inappropriate elimination, soiling indoors due to fear or anxiety. Recognizing these signs is the first step in understanding that your dog may be traumatized and in need of rehabilitation. Creating a safe environment. Creating a safe and nurturing environment is paramount for the rehabilitation of a traumatized dog. A safe environment provides security and a sense of predictability, which can help alleviate anxiety and fear. Quiet space. Designate a quiet and calm space in your home where the dog can retreat when feeling overwhelmed. Ensure this space is free from loud noises, distractions, and excessive foot traffic. Consistency and routine. Establish a consistent daily routine for feeding, exercise, and rest. Dogs thrive on routine, and a predictable schedule can reduce anxiety. Safe physical environment. Ensure the physical environment is safe and free from hazards that could potentially trigger anxiety or fear. Baby gates, secure fencing, and removal of potential dangers are essential. Building trust and attachment. Trust is the cornerstone of rehabilitation for traumatized dogs. Building a strong bond and attachment with your dog is essential to their emotional recovery. Patience and understanding. Approach the dog with patience and understanding. Avoid forcing interactions or overwhelming the dog with attention. Allow them to approach and engage at their own pace. Positive reinforcement. Use positive reinforcement techniques to reward desired behaviors. Treats, praise, and toys can be powerful motivators for a traumatized dog. Calm and gentle handling. Handle the dog gently and calmly. Avoid sudden movements or loud noises that can trigger fear responses. Avoid punishment. Refrain from using punitive measures or harsh discipline. Punishment can exacerbate fear and anxiety. Gradual exposure to triggers. Gradual exposure to triggers that cause fear or anxiety is a fundamental part of desensitization and counter-conditioning. Identify triggers. Identify the specific triggers that provoke fear or anxiety in your dog. This could be certain sounds, people, objects, or situations. Controlled exposure. Expose the dog to these triggers in a controlled and gradual manner. Start with a low-intensity version of the trigger and increase exposure gradually as the dog becomes more comfortable. Positive associations. During exposure, associate the trigger with positive experiences. For example, offer treats or playtime when the trigger is present to create a positive association. Seeking professional help. In many cases, rehabilitating a traumatized dog may require professional assistance. Trained animal behaviorists, veterinarians, or certified dog trainers with experience in working with traumatized dogs can offer valuable guidance and support. Behavior modification. Professional behaviorists can develop a tailored behavior modification plan to address specific issues like fear, aggression, or anxiety. Medication. In some cases, medication prescribed by a veterinarian may be necessary to help manage extreme anxiety or fear. Medication should always be used in conjunction with behavior modification techniques. Group classes and socialization. Participating in group classes or controlled socialization with other dogs can be beneficial for building confidence and improving social skills. Time and patience. Rehabilitating a traumatized dog is a process that requires time, patience, and dedication. Progress may be slow, and setbacks are possible. It's essential to remain patient and not push the dog beyond their comfort zone. Conclusion. In conclusion, rehabilitating a traumatized dog is a complex and sensitive process that demands understanding, patience, and a comprehensive approach. Recognizing the signs of trauma, creating a safe environment, building trust and attachment, gradual exposure to triggers, seeking professional help when necessary, and allowing time for recovery are key components of successful rehabilitation. Each dog is unique, and the rehabilitation process must be tailored to their specific needs and experiences. With dedication and love, many traumatized dogs can regain their confidence and lead fulfilling lives as cherished companions. If you liked this video, please click the subscribe button and share.